Patient as influencers, here we go. Patient influencers. It's a new term that has been coined only a few months ago. I'm talking about late 2024 when this lesson is recorded. Super interesting subject when patients are evolving to become influencers that not only help their own patient journey but help influence drug design, innovation design in healthcare, patient journey design, and even policy. Let's go. Okay, who are patient influencers? So, patient influencers are people who are activate their influencing ability or storytelling ability or advocacy ability online, offline, in different types of medias. But when we talk about more specific definition, it's probably referring to social media because public speaking is also a wonderful way to influence, and some would say, yeah, but any patient advocate is an influencer, right? But when I'm talking about the term patient influencer, it's not a term that I coined, it's a term that actually was coined by, as far as I know, at least in research, pharma companies' compliance departments that didn't know exactly how to deal with the surge of patients as influencers on social media and the need sometimes to use them as advisors, as people who help with patient education or medical education. So, this term that I'm referring to in this mini lesson is specifically on social media. So, three main roles that influencers are engaging with: empowering other patients. It can be via patient education, advice, support, inspiration. They build communities around them, sometimes actual communities within different methods. We have websites like School or Circle or other means to have communities. It can be a Facebook group. Sometimes it's just the influencers and the followers together engaging on the actual publishing platform. It can be Instagram or YouTube or X or any other. And those together, alongside with storytelling, um, talents, effects, creativity, and innovation, leading to advocating for change. Because unlike regular patient advocates who are doing holy work, patient influencers are using mainly social media and storytelling to influence for general change for their own sake, for other patients like them, and for healthcare in general. So, patient influencers also, by the way, are caregivers in this specific roles. Um, Patient is a very general and not very cool term, but that's what the industry or healthcare is using. So when we say patients, we mean people that suffering from usually prolonged illness, chronic acute like cancers, but more than often we see caregivers as advocate, as influencers. So for me, they're falling under the same category. There is a matter of trust by other patients, by peers, by followers. And unlike celebrity influencers, the work that is being delivered or the messages are not done in order to promote any product or to sell anything. It's more to achieve the previous three goals that we talked about the slide before. So we have patients raising awareness for illness. We have patients raising awareness for gaps within healthcare, patient journeys, drug development, therapy, medical device development, health innovation, and so forth. So this comes together, but also, other than this, good impact, which also include community building, emotional support, patient education, health promotion, medical education, we still have some issues that arise from it. We have severe problem with ethical consideration here because what if there is a patient influencer that has a lot of followers and now they're offered money to endorse a specific product that is medical? Some countries have different compliance than others. So this is really, really interesting question, ethical and compliant. to see when is it compliant for a patient with a certain illness to promote a product of sort, and when it's only okay to do more public health, public service around it. It's very complicated, and we need to define better regulation and fair market value to work with patient influencers, because in the general population, in the general influencer community, it's a very lucrative thing. And usually, patients are being paid less for their expertise, for storytelling, for speaking. So I expect to see the same, the initial offering to be not as lucrative until fair market value will kick in by the forces of competition, influencing, and advocacy. How do I see the future? Okay, I think that firstly, digital health can benefit a lot from patient influencers. They're already online, they're already out there, they have the audience, and it can be very interesting to combine the two. I can see it grow to just any other influencers marketplace or micro influencing economy, just like we see with other products. We will see more and more. It can empower patients and patient advocates alike, and also patient organization communities and patient leaders, because when you have much more or much many more voices, your general voice is being amplified, so you can advocate better, achieve policy change better, demand better therapies and better reimbursements and so forth. I think that these new phenomena, when done right, with co-creation of innovation in healthcare, patient journey design, technology, and therapy design, we can actually have those patient influencers act as experts, act as communicators, act as presenters. I think that patient influencers are the future for patient advocacy, and I'm very excited to see what comes next. Feel free to contact me on LinkedIn. This is one of my books, and I see you in the next one.